That we can share our screens.
Yep, I'm doing the live stream right now, and then if you guys copied things over, it should be effective. It's just preparing to stream right now. Almost, let's see. All right, and I think we're live. Are you guys seeing it?
Awesome. Yeah.
All right. I just need to make sure it's live in one more area. I can do that here in just a second. I'll go ahead and I'll read our disclaimer. Well, welcome everyone. Thank you for joining us tonight on today's Cancer Conversations and Choices podcast show. And we are so thankful to have you here with us. We're excited to be able to discuss what we're actually just talking about, diabetes and diet and supplements and all the other good stuff. And, what actually really works to help treat or, deal with and manage diabetes holistically. So my name is Marinette Smith. I'm a registered nurse and a holistic cancer coach. I'm going to read off the disclaimer real quick, and then I'll hand it over to Maya and Deb. So this is Cancer Conversations and Choices podcast. It's the general information purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. No patient relationship is formed with us at this time, and the use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition that they might have and should seek further assistance for their healthcare professionals in any such conditions. If you take any action or inaction as a result of any of the content you consume on Cancer Conversations and Choices and podcast. This is basically based solely on your decision, and the Cancer Conversations and Choices podcast and the host cannot be held liable for any consequences of such action or inaction. Please consult a doctor or your healthcare professional if you have any concerns regarding your health, and always seek the advice of your physician or other qualified health provider with any questions you have regarding a medical condition. If you think you may have a medical emergency, call your physician or go to the emergency department or call 911 immediately. But we are ready to get started for tonight.
Hi, I'm Maya Simon. I'm holistic cancer coach and functional nutrition and lifestyle practitioner.
Hi, my name is Deborah Hernkey, and I'm also a holistic cancer coach and a functional nutrition lifestyle practitioner.
Okay. Who wants to start today? We're continuing our actually conversation from last week. We talked about diabetes last week, and today we would like to kind of dive a little bit deeper in the picture into the diabetes and talk about what is the best way to approach and what your plate would say should look like or preferably look like. We don't know what's the right word to use. To be able to manage or even reverse your diabetes with holistically.
Mm-hmm.
Yeah.
All right.
Okay.
All right. So what have we found?
We found a lot of stuff.
What have we found?
I know we were saying, I was like, when we started it, what are we talking today about? We're talking about diabetes today. Do we have any questions, to start our conversation with?
I do, and this is for both of you since you are both trained as functional nutritionists. So when we're talking about diabetes and managing that, you hear a lot of times it's like, oh, take care of your diet, exercise, do those kind of things. Um, but I think people get confused. I know I would if you're consuming social media, you're consuming information from your friends, your family, then your healthcare provider, and then other media sources. And so it kind of gets confusing. Do you start like just changing your diet first? Do you start taking supplements with your diet? Do you take supplements? Because you hear that all over, especially the internet. That's like the biggest thing is supplementing and having that hopefully help manage your health issues. And so I don't know if maybe like the best option is do you do diet first and then see if you need supplementation? Like, how does that all work? And I think it'd probably really help if we can just explain that to our viewers so that that way we can have a better understanding of it. I know personally before my training, I probably would have been like, okay, let's just do everything, all at once. So I think if we can just kind of get a little bit more clarity on that, that'd be great.
All right.
Deb, do you want to start or should I?
Yeah, I can start a little bit with that. And so one of the things that I would, that we've kind of been taught that we've always done in the past is really you want to find out what the root cause is for the most part. So, and you can't really do that unless if you are taking everything, if you're just continuing to eat everything and you have all these supplements that you are taking. So probably I would suggest the first thing I would do is kind of maybe slow down or completely stop the supplements. And I would start with the diet first. So basically you want to clear everything out and start from the beginning, in a sense, because you want to find out what is actually causing, if you're actually what's causing the spike in your diabetes or your blood sugar and that type of thing, whatever that you're looking at. So I that's what I would start with would be diet, because then as you clear that out and you start introducing things back, then you can start saying, well, that didn't work. Well, this is what happened. Then you're going to find how your body reacts. And so that's what I do. Supplements can kind of muddy the waters a little bit, and kind of give you a false sense of exactly where your body is and how your body's going to react to things. So, and you can come back to those later after you've dealt with your kind of changed your diet a little bit. As with all things, and I'm a huge proponent of that, diet, lifestyle, and your nutrition is going to be huge when it comes to diabetes. Probably one of your best things that you can do for yourself when it does come to diabetes, and trying to handle that holistically. That's just what I would start with first, would probably be your nutrition, changing your nutrition.
Yeah, I totally agree with Deborah because in today's day, people are kind of getting smart. Like when it comes to medication, they're not seeing the result and they're switching to a more holistic way. But I would say they're becoming smart halfway. And the reason I would say halfway, because they're kind of like switching from taking meds to taking supplements. They're looking for supplement to substitute for medications. So, and before they think of changing the diet, the people start looking for sources from outside, whether are like, let's say exercise. Exercise is good, which is fine. But people start going through acupuncture, let's say infrared saunas, you name it, like whatever. And diet comes into the picture after changing the diet. They go for supplement, they go for powders, they try different things, like hoping that is going to get relief for diabetes, but not looking into the most important part, which is diet. Because we have to understand what could be a cause of diabetes. Of course, we're talking today, more today about diabetes type 2, even though type 1 is like, I have my own theory, like, why we might get like, type 1 diabetes. Is it really like a autoimmune disease, or it's like maybe body made it at some point because of like, certain things that came to the body, and kind of forced the body into creating type 1 diabetes. So yeah, I don't want to names, but I don't want to put the names out there, but that's my theory again, because I do know some people do reverse even type 1 diabetes being on a proper diet. So that makes me to ask myself a question. Were people born with it, or was it developed at certain time of their age or throughout their life. So going back to the things like, it doesn't really matter. So supplements work same as the medications do. They're not going to take the problem away. They might support your body in some way, but they're not going to take the problem away. And that's the biggest misguidance we have when it comes to diabetes. As someone who have diabetes, and I have tried so many things, like, you name it, from the, berberine, genema, buttermelon, or whatever, like all this glucose control, blah, blah, blah. Nothing would work until I understood that unless I stop putting the source that causes the diabetes in the first place, it doesn't matter what you do, it's not going to help your body to heal or reverse the diabetes. And I strongly believe like our body is capable of reversing diabetes. It's just we have to find that way how to do it, yeah.
You're right. And it's funny because Marinette, when you asked me that question, it's funny. Thinking about it before, I'm like, oh yeah, what would I do? Well, I would do nutrition. And then I would probably do the supplements and kind of, knock those out, whatever. It's about starting over, cleaning the system up and starting over and everything. But there is more to it than that. It's just, it's based on that question alone. That's what I would do. But there, like Maya said, there's a whole host of questions that need to be asked beforehand before I would just say, oh, well, you need to do this and you need to do that. It's really taking a good look at the history of the individual,
Right.
and where the diabetes I don't want to say kind of where it came from, but you want to look at everything. You want to look at environment. You want to look at food. You want to look at, any sort of, uh, gosh,
Stress.
stress.
Yeah,
Mold.
stress is a
Are they
big
active? Are
mold.
they,
Yeah.
is
Mold.
there
Yeah.
is there a weight issue already? Is there, so there's a whole host of things to take a look at. And of course, and if they're already on medications, taking a look at that also. And of course, not, being a doctor, it's like, here I am saying, oh yeah, just drop everything and start from the beginning. It's not that easy, and I want people to realize that it's not that easy. It's really taking a good look of, it's taking it, well, that's what holistic is about. You're looking at the whole person, and really putting it together from there to come up with a good plan for
You
each
know what?
person.
So right. You know what is the other interesting thing is, like, when I looked it up at American Diabetic Associations, and I went there and I looked it up there, the recommendations. So the quarter of the circle, the half is the are the veggies, the quarter of the circle are, carbohydrates, and another quarter is protein. So and when I was just curious to look at through the carbohydrate intakes, and the carbohydrate intakes, it goes from non-starchy vegetables, or I want to actually share the screen and go. I have it open there, and it just the thought crossed my mind. Okay.
Yeah, absolutely. Since we're
Yeah,
talking about
let me just,
nutrition
yeah.
anyway, that's a great place to
So
start.
we're talking about nutrition. This is American diabetes food. No, this is not. Okay. What is this side here? It says diabetesfoodhub.org. Okay. Anything.org comes from government, of
Okay.
course. So this is their recommendations. So half of the plate are non-starchy vegetables, carbohydrate food, protein food. And I was just curious to scroll down and see like what are the non-starchy vegetables here. So the vegetables looks
Are those the ones in red, Maya?
some I find, yeah. I don't know what this red means. Let me see. Just clicking on it for green beans. Okay. Oh, the recipes. So it
The
shows some
recipes for
recipes.
it?
Yeah. Yeah.
Oh my
But
gosh, this part is so good.
yeah. So
Okay, that just made me hungry.
when we look at this, like this page here, like green beans, pea pod, like snow peas, and and sugars, snap peas, whatever. So I want to talk about this part, this all vegetable thing, separately. That's one of the things. And then that we go into the 1/4 of a page, which is like protein, they're fine. And then we go into the page where it talks about carbohydrates. And when I was scrolling down through the carbohydrate, it says whole grains such as brown rice, bulgur, oatmeals, polenta, popcorn, quinoa, whole grain products, bread, pasta, and tortillas. So starchy vegetables such as corn, acorn squash, butternut squash, green peas. So beans, like black beans, kidneys, and stuff. And the reason I'm bringing this up, like this whole section here is basically the cause of the diabetes. This whole thing, and then some part here, I would say, all this like carbohydrate rich veggies are one of the main causes of diabetes. People with diabetes, when the doctor does give a recommendation, and this is exactly what they give, by consuming everything. And the
Full of
people
sugar.
consuming, it's full of sugar. So people keep consuming by stating the doctors told them, and this is on a government website. Okay, they go and they keep consuming and they're getting insulin and they're getting metformin, and never crosses their mind that could it be a food that I'm eating? And they keep saying, oh, this is, by the way, on the government side, this is their recommendation. So people, stop and ask yourself a question. If that would have worked, why is your blood sugar still spiking? Why? Why are you doing the same thing over and over and hoping to get relief from diabetes if you're not removing a source? So this is, and then it goes here, low calorie drinks. So I didn't even go through the low calorie drinks, but whatever. So my whole point is like this whole website is such a misleading and misguiding website, particularly when it comes to people with diabetes. So we would like you to ask yourself a question. If this food would have worked, why did not work up until now? Why are you still having that spike, the blood glucose spike? Why is it happening? Why does it keep happening? It's not, and you're gonna jump and like, because I get those text messages and emails like sending me pictures. Oh, I found this supplement. Do you think is this good? Is cinnamon good for diabetes? It's not gonna work. It's not gonna work because you're still eating what you were told to eat.
Exactly. There's no
Right?
change in the lifestyle part of it. Or if there is, there might be some
Yeah.
change, but not enough to be able to make a long-term difference that has been going on for probably years and years and years. It's not going to be like that quick fix like
Yeah.
everybody's we're wanting. We're used to consuming and doing it so immediately. And so
Right.
I think that that's like a lot of that thought process goes instead of going back and saying, okay, what am I putting in my body? What am I surrounding myself with? Am I really doing everything that I could? But I'm really glad that you brought up like the vegetables and even the grains because I was eating mostly plant-based. I had this is something I wanted to talk about too was metabolic syndrome. And so I was trying to reverse that. And so I'm sitting here going, okay, my A1C is like really good. My blood sugars are low for the most part, but I'm still having sugar spikes. Like why? It just didn't make any sense. And I mean, I was trying to eat more proteins, but there's still carbs. I mean, most of a vegan diet is carbohydrates.
Carbohydrates.
So
You
how,
cannot, yeah. You
yeah.
cannot eat enough if you're not consuming carbohydrates. Yeah.
Exactly. And I think that's one thing to remember also or to consider. And I don't think people did because this is something that was really new to me that kind of opened my eyes too, was the fact that, high blood sugar is not the cause of diabetes. It's a symptom of diabetes, but it's not the cause of it. The cause of it is the body it releases insulin, basically, rapid insulin piling in your bloodstream, and that happens when your pancreas releases so much, releases a flow of insulin in your body and your body can't take anymore because you keep eating, you keep the carbohydrates, you keep feeding yourself these things. And to understand what a carbohydrate is, it breaks down into sugars. And
Yeah.
so your body's producing too much insulin. The insulin has no place to go. And that's the problem. And so when, we talk about nutrition and changing the nutrition and how we eat, it's really serious. It's not the rice. Don't eat the rice. Don't eat the pasta. All those carbs turn into sugars. And that's where, I think when you talk about holistically and trying to, prevent diabetes, that's what you need to do is changing that. So because you want to stop producing that, but give your body a break. It's working. Oh, your pancreas is working overtime, you know. And because when you have the insulin that's building up in your body, you see it drives up the blood sugar, and
Yeah.
then you've got, you're thirsty, frequent urination, the sugar cravings increase,
Yeah.
lack of energy, so you're lethargic, loss of libido. You start realizing all of these things, and it's really, it's the
Yeah.
diet, and it makes a
Yeah.
huge difference. But it's that insulin spike it just keeps piling up. Your body doesn't know
Mm.
what to do with it.
Yeah. It
So what
it
do
it most importantly, it affects the mitochondria. It would damage the cell.
hmm
Mhm.
Yeah, the
And
cell can't
damaging
take
damaging the cell is like
Mhm.
hmm
it converts it into the chronic condition, and that chronic condition start converting into the a condition after a condition after a condition after a condition. um it goes all the way down to developing cancer. And
Mhm.
we keep we keep putting the source in the body that causes diabetes. Now we're asking the question, why are we doing that? Just because somewhere someone had said so, without questioning where that information is even coming from. Is that
hmm
really that has to be, the way of doing that? And when it comes to vegetables, also, the vegetables are very high in lectins, and they're high in, other oxalate. Oxalate
Oxalates.
is another,
Yes.
yeah,
hmm
oxalate is
The
another
oxalates.
thing that oxalate binds to calcium. Your body get malnutrition, you, and then it does affect your blood insulin levels,
Mhm.
your blood glucose levels. People think, oh, I'm just consuming vegetables. You have to know what kind of vegetables to consume too. You
hmm
don't want to consume vegetables like it says pea, it says like, the beans, and they're all high, the nuts, the seeds, they're all high in oxalate, they're all high in lectins. If you don't know the process, how to process them before the consumption, all you're doing is damaging your own body.
Yeah.
Yeah.
That's it,
Well,
right?
yeah, exactly.
Yeah,
And for people that don't know what oxalates are, just think of kidney stones. I'm sure you've heard of somebody that's had a kidney stone or you've had one
right,
and they're not
right,
wonderful.
Oh
They
right.
can
yeah.
cause lots of
Yes,
problems. They can cause infection. They can be not good for your health.
yeah,
So if you're wanting to know
uh,
what the oxalate and the connection is there, that's what that is. So avoid kidney
yeah,
stones.
Yeah.
yeah. A
Have a
very
kidney
great,
stone. That'll make you
exactly, yeah.
look.
Right,
Take
right.
a second
Um,
glance.
A very great book to read by Sally Norton, that called Toxic Superfood. If you want to learn more about oxalate and other food, by the way, the book is right here. That if you want to really read and learn about it, this would be the recommendation. You're gonna understand when people develop kidney stones, they don't realize where it could come from, and it does affect, like, it because of oxalate bind themselves to
hmm
calcium. They deplete the calcium from many part of your body, including your bones. Let's speak about osteopenia. Like, that's another way of looking at the things. Like when you consume a lot of vegetables with oxalate, osteopenia could be, one of those side effects. Parathyroid, hormone um, imbalance. And then your body reacts to sugar. Your ovaries react to sugar. PCOS, the PCOS has been linked highly to a higher glucose, higher, uh, sugar in the body. And I believe so, you know, people with diabetes do have, PC more than any other person without diabetes would have PCOS. Your estrogen levels, your glucose and estrogen production in your body, the glucose affects everything. So before building that place, you always have to do your homework and learn about it and exactly think like, okay, is this really the right thing for me? Just because you're taking medications and lowering your blood glucose levels, that doesn't mean you're helping your body and yourself.
Exactly. Well, that even like is the
Yes,
supplements, even if you're taking them, I mean, it's not as
right,
bad, but you're just still, it's like putting a Band-Aid on it, just like with the medication. If you're not
right.
addressing those root
Yeah,
issues, it's just going to keep causing problems.
right.
Hmm.
People might
Exactly.
have, yeah,
And that
sorry.
medication can cause, I'm sorry, the medication can cause additional problems as well. So now you're
Yeah,
just compounding the issue and not really, yeah, not getting to
yes.
the root of the problem.
Hmm.
You know,
That's it.
back in the day, I remember back in the day, because I feel so old. Um, you
Thinking when
know,
you're
they
saying
used to
that, I'm
call it
like,
onset. Right, back in the day, if my kids were listening to this, they'll be like, "Yeah, I walked uphill in the snow, barefoot." Um, I used to always hear, "Oh, I've got adult onset diabetes." You don't even hear that anymore. And
Mhm.
so I was kind of looking that up. I thought, well, what exactly is, adult onset diabetes? And they used to test for insulin. They didn't test the
Yeah.
blood sugar. They tested the insulin levels, in
Mhm.
the blood. And when a person was diagnosed with type 2 diabetes, it was based on the amount of insulin
Mhm.
and not their insulin in their blood and not the blood sugar. And
Right.
we don't do that anymore. We don't
No,
No.
do
it's
that
not
anymore
standard
at all.
practice
Yeah.
to check
It's
the insulin levels for insulin resistance. And I really do think that that's why people walk around with metabolic syndrome and then all of a sudden, bam, they find out they have diabetes. Well, they probably
yeah.
had it building up for a really long time. And if you hear, especially women, as we get
Yeah,
closer to menopause, you start hearing a lot more of those complaints like, oh, like, and you hear it all over the news and stuff too, media, balancing your hormones. Are you feeling sluggish, weak, and tired? Well, I mean, really look at your insulin levels. Are you insulin
Yeah.
resistant?
yeah,
Is your body balancing blood sugars correctly? Are your hormones
yeah.
being able to be balanced correctly because you don't have too much insulin floating around?
Mhm.
I mean, there's so many things that are a part of that. And, yeah, like if you just tested for that when people come in, especially,
Right, right.
if it's a woman coming in that middle age, I think men do too. But check for that. It doesn't cost very much. I know I pay for it out of pocket. I'm sure you ladies have too. It really doesn't cost very much to pay for that test. Those couple
Yeah.
of tests. But
Yeah.
I mean, really, it gives you a better picture instead of just going to the primary care, having those couple of tests done for your wellness. When you're getting your wellness done, you should really ask for those diabetes panels so that you can get the insulin sensitivities along with it, and then you can take that on to your doctor. So I
Yeah.
just think it's a really good idea to do that. I'm just surprised that they took that out of standard
Yeah,
practice.
exactly. And
Because
I
yeah.
was really kind of wondering when they took that out. When
Mhm.
did they really stop doing that? And that I couldn't find, that information, but I thought that was interesting. So we kind of stopped really kind of treating or looking at the root problem of, for folks, and we just went, well, let's just do the blood sugar and that's good, and we'll
Yeah.
just say
There
stop eating
yeah.
sugar, or hey, we'll put you on this medication and you'll be fine. And
Yeah.
then people probably figure, well, then I can eat that ding dong, or I can eat that
Right.
rice and lasagna and everything, and therefore it compounds, it just keeps compounding. So
Yeah.
yeah, really kind of it was
Yeah.
interesting. But and it's
Yeah.
not like you can't eat starches. I mean, you can. That was another thing that I read, was, if you're going to eat starches, within 15 minutes after eating, and it doesn't mean, completely eat the entire tray of lasagna, although it would be really good at times. Um,
Right?
it's go walking. Go
Mhm.
walking. You want to burn it off. And what does that do when you're burning it off? you're putting oxygen back into your bloodstream, and that oxygen is creating more cells, and it's being able to carry those sugars that are being broken down away and flushed and removing those toxins, which is that's what you want. You want to get rid of them. So therein lies the whole exercise piece.
Yeah.
Getting
That's
out.
right. But we're not promoting eating lasagna and eating every single day and going for a walk. That's not going to do anything, right? So we're just saying if you end up eating a lasagna or anything like that might spike your blood glucose levels once in a while. So you can end up doing that. You can hear all over the place. There's two things that I want to touch. One, eating fructose, a lot of people are saying, and you can hear all over the social media, fructose is different from glucose. Your body is not reacting to fructose, is not going to spike your blood sugar level. Actually, the fructose would spike your blood sugar more than glucose would do, because the way it metabolizes, it's same as alcohol, and it just like it would do the same thing. So there is a test like that called fructose, I believe so, the test called fructosamine that you can check and you will see the difference. Like, it's actually would spike your hemoglobin A1C and spike your blood glucose levels higher than the glucose would do it. So that's another myth out there. So the second part that I really want to talk about, when I was in nursing school back in Russia, and we were learning about diabetes, and in the class, we were talking about hemoglobin A1C. At that time, this was 1987 and 1989 when I graduated, 87, 88, 89, 90. So the blood hemoglobin A1C was considered to be normal between 4.3 and 4.7, 4.8. So if you're at 4 that was a normal level. So if you go to 4.9 or 5.0, that was already pre-diabetic and diabetic. So yes, so this is based on our human biology. Okay, our human biology, because the way we process the glucose. Nowadays, 5.0, 5.1 considered to be normal. Just because someone put it out there that normal, that doesn't mean your entire body's biology had changed overnight according to the numbers they've been put out there and you're not diabetic or pre-diabetic. That is one of the biggest myth is out there. Doctors are doing the blood work on people and saying, oh, you're good. You're not diabetic, 5.0, 5.1, you're good. No, you are pre-diabetic at this point. You're going to become a diabetic in some years from now if you're going to continue the same lifestyle. Just because the number changed, because a lot of people in our days are so overloaded with carbohydrates. People's glycohemoglobins past that stage of going to 4.7, 4.8 anymore. They just go to over 5.0. And because many people are having that number, they made that number normal. That doesn't mean your body's biology are functioning right. This is another thing to look into that. So, because we have innate ability of our body has its own rules, its own way of functioning. Just because the numbers are changing there or someone is telling you this is normal, it doesn't mean it's normal. Stop looking at the numbers, do your research, learn about it. As someone who have diabetes and not taking any medications and being on the lower side. So if I would eat and consume carbohydrate, yes, my blood sugar is going to spike, but I'm not allowing it to happen because of my diet. So I know, I have read, I have learned, I understood between balancing your blood glucose levels to reversing your blood glucose levels. What does it mean? You don't have to balance your blood glucose levels, because balancing means you are agreeing to get stuck with the condition and getting worse. And that's what my understanding. It's staying here. That's what my understanding is. You're agreeing to that. You're signing up for that.
Mhm.
The balancing, because people will tell you drink apple cider vinegar before your meal, eat your veggies before you eat whatever, a walk after the thing, but continue putting the carbohydrates into your body, and you're going to balance your blood glucose levels.
Mhm.
Why would you want to balance if you can reverse your blood glucose levels
Very
and give
true.
yourself a freedom? Give yourself a freedom, of living your life fully.
I think sometimes that's like not even thought of. It's like once you get a chronic condition now, a chronic condition, it's like, oh, you have it for life. You're stuck with it. I know even coming from, the healthcare world, more recently, and learning some of this stuff, I was even seeing it as like, oh my gosh, it's not just about balance. You have to completely reverse it, and you can. That's the
You
thing, that there's
can.
hope. You can reverse it. Like, you are not left with having that diabetic diagnosis for the rest of your life. You absolutely can.
Yeah.
It's in your hands. But I think a lot of things we get mixed up with, especially with our culture, is we want to enjoy the pleasures of life, right? And then if
Yeah.
you always hear moderation, and I used to say that all the time, like moderation is key. It's
Yeah.
not. It's
It's
actually
not.
keeping us sick.
Yeah.
Moderation is keeping us sick.
Yeah.
Um,
Moderation is like when they talk about it, I think people talk about moderation because it makes them feel good that they don't have to give up on certain food that they really like.
mhm,
I understand that, like, and I do see that because, my brother would say that, like, the doctor would say in moderation. But the point is, it doesn't matter what who says what, you pay attention to your own body. You see
yes.
that if that moderation is working for you, be my guest, do it, right? If you don't see the result with that moderation, why are you keep doing the same thing? That's what my question. Why are you doing the same thing what you were told just because someone else said it?
Mhm.
And
I
that
think it's
is,
an education piece. I think it
yes,
goes back to education, and we don't learn that.
right.
And uh, medically, that's not what's happening.
Yeah,
We get a prescription for a drug that just kind of you know, keeps that blood sugar, where it should be. But and I think that's the thing is understanding how everything breaks down, what a carb is and how that breaks down, how it affects your body, and what insulin is and how that affects your body, and what exactly diabetes is, diabetes 1, diabetes 2,
yeah,
and how that, over the years it can really impact. I mean, you're talking, yes, okay, I've got high blood sugar, and I've got, I'm pre-diabetic. Okay. So that's what I was told. I'm pre-diabetic.
Mhm.
Okay. So how are you going to tell me what should I
yeah,
do?
Yeah, what do I
Well,
right.
do?
they
Yeah,
don't tell you that. It was just
yeah.
like, okay, this is what this says. You're a little high, but that's okay.
Mhm.
Well,
That's
no,
not
I don't want to
okay.
be high
No,
at all. I
no,
don't want to be
no.
high. I want to be, low, and I want to be within limits, and I want to, but that's not talked about.
Yeah,
that's where, and I think that's,
And there's just not
yeah.
enough
why we're here.
time.
And
There's
And
there's
then,
really not
not.
enough
right.
time. Not enough time
No,
at
Mm-mm.
and one
all.
of my favorite thing is like when the doctor would see like you have a spike of glycol a little bit, they would say, oh, you have a pre-diabetes. Like, we're just gonna watch and see. Some doctor
Mhm.
would say, watch your diet, right? And
Mhm.
but they would never explain what to watch in a diet.
Yeah.
That's one of the things. The second is, and I'm not blaming doctor, but just the system, the way the system has been built.
Oh yeah, it's
Exactly.
I'm not
totally the
like, yeah,
system.
yeah, blaming the
Hmm.
doctor. It's totally the system. And they would say, we're gonna watch and see. So what are we watching? What are we watching at this moment? Seeing
Yeah.
when I'm gonna become diabetic?
Yeah, it's like you're
Is that
waiting. It's
what
like
we're
you're waiting
watching?
for
We're
it.
waiting to become
Yeah.
and we never asked. Oh, doctor said that any test that shows any sign of anything would say I'm a little higher than normal. We're gonna watch and see. Come back in 6 months. What are we watching?
Mhm.
Your body start giving you a signal. What are we watching? Why are we
Exactly.
watching?
Am I waiting for my feet to start tingling?
Exactly.
Am I waiting for
Right.
the neuropathy to set in?
How about some memory
And by that
loss?
time, it's
Exactly.
yeah,
So there's diabetes
so
number 3,
much.
there's diabetes number 4, there's diabetes number 5, and they go under like a dementia, Alzheimer's, cancer, you
Mhm.
name it, ALS, you name it.
Yep.
There's diabetes, there's many different form of diabetes. Why? Because blood sugar levels are blamed to be bind to those proteins and those fatty to lipids, and cause the glycation and cause the damage to the cell. So those are not fat to blame, those are not protein to blame, and it's a carbohydrate to blame, because when they bind to the cell, the glucose molecules, when they bind to the cell, and it doesn't really matter where the glucose is coming from a carbohydrate, from beans, from bread, from apple, from juice, it doesn't really matter. The glucose atom is a glucose atom. It's going
Yeah,
to bind to protein, it's going to bind to fat. Okay, and it's going to change, it's going to glycate that molecule, and it causes more damage to the body.
Mhm.
I
So
have a
this,
yeah.
yeah,
I was
yeah,
gonna say I have a question about that. So you're right so if I'm going to the doctor and they're telling me this, don't and I've never, no one has ever said, Deb, you need to see a nutritionist, or our dietitian. Nobody has said that to me, but I don't know if anybody on here has or
Oh,
whatnot. But I'm
wow.
curious what they say. If they say, well, here's the phone number to our nutritionist, give them a call. How many people really do? Or if they say, hey, we made an appointment for you,
Mhm.
what does the nutritionist say? What are they actually telling? What are they explaining to people? That's why I'm curious about that. I don't know. I'm seriously just asking the question because I don't know. And that's where our education comes in also. I mean, it's a system, yeah. We have a
I,
system that's
Well, and there's a huge thing called diabetic education.
yeah,
And there's also obviously the dietitians and stuff within a hospital organization. Um,
yeah,
Usually there's not enough dietitians to be able to fill that, or even nurses that are trained to be able to do that. So there's can be a long wait list. There can be like schedules. There's a lot of people that are resistant to it anyways. I know that when I worked at the clinic that I did, we would provide that information for them, but we would also send over the referrals too. So I worked with some really awesome providers. I know now, especially now that I'm in a very much a larger area, I can see now what the majority of the Americans are talking about, because where I came from was is not normal, is not normal. They were very, very thorough and did take care of their patients really well. And I'm sure that there's other places like that too. But for the most part in this healthcare system, it's just a mess. It's a hot mess. You might be like 3 or 4 months down the road before, hey, you can get into your nutritionist, or hey, you can go see diabetic education. It might be months and months. So what's happening in between that time? Well, people are doing their own research. People are trying
yeah,
to figure out how to take care of things on their own. They're getting information, from government agencies. The American Diabetes Association is one of the main contributors for like diabetic education in healthcare. So if we're seeing
yeah,
like what you just showed us, and we're still seeing people that are like claiming, I'm because we hear this a lot too, especially in the holistic world. I'm really healthy. I keep my life, like I eat healthy.
yeah,
I'm active. I exercise. Well, if you really look back at it, their diet is still a problem. Like that's just
yes,
still an issue. So I mean,
yeah,
there's so much that's not being addressed, even on
yeah.
a bigger level.
Well,
yeah,
you know what I'm thinking while you were talking about that we have created this like organizations like American Diabetic Association, and then other organizations, even in the hospitals, like diabetes awareness and blah 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 blah. So I'm looking, it's like there's so many positions has been opened on that field, like to help people to, with diabetes. And the bottom line is like, elimination of the source, to be able to reverse your diabetes, right? It's elimination of the source. So we created this whole entire picture behind our backs, like, of thinking is diabetes is something you cannot control, you cannot take care.
Mhm.
When the main problem of the diabetes is basically carbohydrates. We employed so many people who could do a great job doing something else. We've been employing, like, I mean, this organization are misleading and misguiding people, are
Mhm.
causing more diabetes, and we have, and then even though registered dietitians, like sometimes when I talk to registered dietitian, it blows my mind.
Mhm.
They would keep telling you, oh, your body needs carbohydrates.
Oh,
And I would always say, okay, yeah.
Mhm.
I asked them a question, who said that? Where did you get that information? And they bring the evidence, but those evidence are not backed up by any science at all.
Mm-mm.
Not at all. So not even close. So it's for us as people, it's like instead of sitting and listening, you don't need registered dietitian. You don't even need a nutrition coach. Like
Mhm.
if you want one and need help for someone to explain to you, fine. But you don't need, you can do your own research, you can do your own homework, you can do and ask, keep asking yourself a questions. When someone tells you that eating brown rice is better for diabetes than eating white rice, personally, there's no difference between both of them at all. Yeah,
Really? I mean, I
right?
have,
There is
but
no, yeah, there's no difference whether you eat that and that. They're both are gonna spike your blood glucose levels. The bottom line, they're
and
carbohydrates.
they don't
That's
tell
it.
you that. They always tell you, oh,
And no,
it's a really good rice to choose. Eat brown rice if you're going to choose to
right.
eat rice.
Right. Or oats. Oats
Yep.
are like disaster for diabetes. It's a disaster. It's not even like a putting a fire in the body, into the causes. It's a
Mhm.
putting a bomb
Big.
in the body. Yeah, it's explosion for the diabetes to explode. Like, the oats, it just like a people, please do your homework, do your it's like as someone who've been through diabetes, struggled and suffered, like, I did have neuropathy, I did have so many, like sleepless night, the kidney pains, there's so many conditions. So they all go away. One, if you do what you have to do in terms of like cutting down completely carbohydrates, or at least eliminating majority of it and keep it very small amount that does not spike your blood sugar levels,
So you're
right?
telling me
Mhm.
you reversed your neuropathy,
Yes, I did
you
reverse my
reversed your
nerve.
kidney pain, you
Yes,
have reversed, gotten the blood sugars to now like they're really good. Like you're not in the danger zone any longer.
they're not in danger zone.
That's
Yes.
incredible. Like I
Yeah.
always tell my husband, like I get home from work or whatever, and be like, I never want to have diabetes. That's like the absolute worst disease you could probably ever have. Like
Yeah.
and because you always think that you're going to be stuck with it for the rest of your life, but you're proof. And there's other people that you know that are proof.
You can. We're living in such an amazing body that as long as you give a chance, it would reverse itself. It would start working um, toward you, keeping you
Hmm.
healthy, keeping us healthy. It fights for for us every single day. The body fights for us every single day.
Hmm.
For us to breathe, it repairs, it fixes the damage, it repairs the damaged cells. You don't even know what does it do inside. And then yet at the same time, we take that for granted. We still torture, we still putting like uh all these toxins, everything to the body that we have to be grateful for it instead of like giving everything nasty stuff. I
Yeah.
work with the clients, like one of them are 77 years old male who were like half of his life diabetic, and then 30
Mhm.
years, I believe so, 30 years on insulin. Like by going on the proper diet, on a ketogenic diet, within 3 months, this person, 77 years old, went off insulin. It and I was thinking at the time when he told me that he went off insulin, I was thinking like, wow, what an amazing body we live. It doesn't
Mhm.
matter what age you are. It doesn't
Mhm.
really matter. When you cut the source,
Mhm.
your body start healing process. That's it. That's it.
Mhm.
It doesn't really matter what you do. I don't care what people tells me, oh, you need carbohydrates. Show me the proof. Show me the proof. That's what I would ask. When you show me the proof, then I would trust you, but I could not find any proof. You need that, you need this. No. All you need is just cut down carbohydrate, and you don't need those big organizations like American Diabetics Associations and other associations. You don't need them, and you don't need to listen to them.
So then switching to a different way of eating, obviously then if it's removing like carbohydrates, it's going to increase your protein and your fat intake, macro levels if we're thinking about it. That would probably,
We still have to watch like a protein because
mm-hmm,
protein and fat still come convert into the glucose because
mm-hmm,
that's a natural way of our body making the glucose.
mm-hmm,
For someone who is diabetic, protein has to be in moderation. That's when I would use the word moderation.
mm-hmm,
I would add more fat because your body has to switch from burning, energy from glucose into burning energy from fat. And
mm-hmm.
so there's never enough fat in our body because fat makes so many things in our body. It makes hormones, it like, repairs cells, it does a lot of action in our body. So whatever body is going to use to repair or to make new cells, it's going to take it, the rest is going to get converted into the energy. And you never can have enough energy to use. So fat would be probably something that I would push in, like, the diet and moderation of not carbohydrates, sorry. The
Protein.
protein.
Mm-hmm.
Yeah,
The protein.
protein and very, very, I wouldn't even recommend any carbohydrates, but if people cannot hold themselves. So it would be probably something wild blueberries,
Yeah, I'm
not
back.
every day,
Just every now and again.
yeah, yeah. Why wild blueberries? Because they're low in glycemic index and they're low in fiber. So
And they do
that's
have some pretty
something.
good properties in them. Yeah.
Right.
Yeah.
Strawberry. I would say strawberries. If we would have find the strawberries, like, the original strawberries, the
Mm.
little ones, then yes. But
Little
nowadays the
tiny.
strawberry has a size of it's the size of an apple and filled with glucose,
Just
so
sugar. It's just
it's all
sugar.
sugar. Yeah. So blackberries and raspberries are they're very high in oxalate. That's another thing that
Mhm.
it doesn't matter if you like them or, I mean, like I like them, but I don't eat them because of the oxalate index that is like also would cause kidney, you know,
Yeah.
kidneys are during the
Kidney
diabetes,
stones.
kidneys works like, yeah, kidney stone. And during the diabetes, if people have diabetes, the kidneys are overworking themselves because the
Constantly.
body constantly, the body
Hmm.
has to remove that and trying to clean up and trying to remove that. That's why people urinate during the diabetes because body trying to eliminate glucose as much as it can.
Hmm.
That's
Yeah.
why we have
Trying to
urge to
balance it.
urinate. Yes, to balance.
Hmm.
That's why people have an urge to urinate.
Hmm.
And then and kidneys are overworking. But if you add on the top of the diabetes, you add the oxalate, you add other things, you kind of causing more damage, more like creating more kidney stone, uric acid, other things
Hmm.
like, that's another damage, to the kidney, to already compromised kidneys.
Hmm.
So that's
Hmm.
another level of looking into the like how much veggies you want to eat,
Hmm.
to repair. And the protein and fat would be the health choices. As I
Hmm.
said, ketogenic diet would be the probably health choices for people.
Yep.
And even going carnivore, it's gonna be better than eating one time a day
Hmm.
or another option. Instead of eating 3, 4 meals a day, you don't need to eat 3, 4 meals a day, even though you don't consume carbohydrate, but every meal is gonna still release insulin.
Hmm.
And if you are trying to reverse your diabetes, you got to be mindful by eating a little less, fewer meals a day than eating a lot of meals a day,
Hmm.
3 or 4. So 1 or 2 meals a day is ideal. But
And
again,
it's amazing the body adapts though, because I mean we're
yes,
talking and we're familiar with it, and there's going to probably be people listening out there. Oh my gosh, only eating one day, like one time a day, I'd be starving. But what's
believe
amazing
it or
is when you
not,
start eating the way that your body's intended to take, the natural foods in, natural foods from the
natural
earth,
for
how we're intended to take them in. Your body finds a way to just be able to fix itself.
yes.
Hmm.
Well,
And
your
you,
body gets satiated. It gets
yeah,
satiated with the proper foods, the nutrients that it needs, that you don't crave the sugars anymore. You don't crave like, oh, I need 4 helpings of that. I don't, you just your body has it starts functioning the way it should be. should be functioning.
You know what it reminds me of
Yeah.
is it mimics your body naturally doing like what a GLP-1 medication will do, like an Ozempic. So
Yes.
like or a Wegovy. What I'm thinking of is when we're talking about like the more proteins, the fats, getting away from the carbohydrates, eating more of those natural foods and not having the sugar spikes. That's what you're doing and that's what you're going to.
Yeah. With GLP-1, people are getting GLP-1 shots just
Mhm.
because they don't want to
Mhm.
stop eating the way they look. If you don't want to do it, if that's totally up to you, right?
Mhm.
If you want to get the shot because it's easier for people to do
Mhm.
getting those shots and continue eating the way they're eating, and they're thinking they're getting they're doing themselves a favor and
Mhm.
repairing their
Yeah.
body, which is not. So the way our body could make GLP-1 naturally, because it's always made, it's
Mhm.
always been there, it's part of our body. And the
Mhm.
way it's always would work, like you need fat. The fat
Yes.
is gonna make fastest way of activating GLP-1. And I mean, like fiber would do it, but again, fiber goes through many processes because it would create GLP-1 and the body loses more energy, and the fiber might work a little bit differently in people, particular people who have SIBO, IBS, IBD, and
Mhm.
colitis, different Marianne, colon issues or digestive issues.
Mhm.
So, but consuming fat would be the easiest way of, getting your GLP back on the
And
track
it
and
just seems so opposite because we're
yeah,
trying to lose weight. Hey, on a second, like
fastest
waiting to
way.
eat fat. Like that's totally
Yeah,
the opposite of what we've been told. The
yeah,
majority of our lives. And
yeah,
so it's like you really have to accept it and say,
right,
okay, this is
right.
what is I'm finding this is the information that I'm learning now. What I was using before was not working. And
Yeah.
changing your mindset. It's hard, but it's totally worth
Right.
it.
That's why a lot of people, when they get like GLP-1, those peptides or
Hmm.
or Ozempic, whatever they're getting, that's why they start suffering with digestive issues because
Mm.
GLP-1 getting produced in the digestive system in our gut. So, and then it blocks that. If it blocks one thing, in our body, everything balances itself. It's like a chain, if you take something out, then down the road, it's like a domino. Like, you hit one, you're not going to just take one, you're going to hit every domino like around it, right? So,
Hmm.
same thing in our body. So, if you're blocking GLP-1, the other hormones are going to get blocked. Everything else in the body is going to get blocked gradually, and that's why
Hmm.
probably people down the road they start experiencing and having side effects,
Hmm.
and that's another question. Just don't listen blindly just because it exists out there. The medication is out there that's gonna help and cure and heal,
Or the
you
newest
know.
fad, right?
Right. I would like to see that medication that ever healed anyone. I mean, there's a time when people need it. I'm not completely
Hmm.
against medications. Look, when you need it temporarily, okay. But
Temporarily,
that
yeah.
doesn't mean you gotta be on it for the rest of your life. Yeah,
Hmm.
you know. So
Yeah, there's people I can think of, that I cared for in the past that had been on that medication for years and years, and they're still like, well, I'm still struggling. I can't keep my blood sugars like down. My A1C is
right,
still like super high, and it's because it's just like we were talking about putting that Band-Aid on, but you're not changing the mindset, but also
right.
not teaching it at the same time. Hmm.
Exactly. That's a number one question we should ask. I've been on this medication for a while now. Why didn't it work?
Well, that's an excellent question.
Yeah,
Yeah, why am I on this medication? Medications, for the
yeah,
most part, are supposed to be short term.
right. Why
Mm-hmm.
didn't it work? Right?
Mm-hmm.
Yeah,
Because we get written a prescription and we're told to stay on it, and next thing you know, it's 15 years later and we're still on it and nothing's changed. And we don't
right.
see
Or
No,
it's gotten
15 years
worse.
later, yeah, 15 years later, we're going to discover that there's more problems we have,
Yep.
absolutely,
right?
Yeah. I
absolutely.
Yeah.
don't know about you guys. Well, I know Maya, just as we're starting to see the medications dropping off, like, oh my gosh, I thought I was going to be stuck with all of
Oh,
these.
God. I never, if I tell, like, I don't take any, I barely take any supplements. I don't take any meds.
Hmm.
So I like, best health I ever had in my life, best mindset, best health, and best body that I ever had. And
Mhm.
I'm going to be 60 next month. So, and yeah, I know. So when I was 40, I wasn't feeling as good as I feel today.
That's so awesome.
So people
Yeah.
have to see this. Like, it's worth probably sacrifice when you wake up in the morning and there's no joint pain. You
Mhm.
wake up happy, you're sleeping at night good. You don't experience anything. Your mind doesn't go crazy.
Mhm.
Even your stress, like you think you want to stress out over something, but then your body calms itself down very
Yeah.
fast. It's like your management of stress is so different
Mhm.
from being stressed out. When I was stressed out before, like I would feel like heart palpitation, the rises, the shaking. I mean, I would feel so
Yeah.
many different things. But now when I'm stressed out, like I would stress out over something, and it just like I wasn't like an hour or two. I'm just like forget about it. Like I'm
Mhm.
done. My mind goes to a different stage, and that
Mm.
happens naturally. I'm not forcing myself or anything.
Mhm.
So your body reacts to the things differently. Your mind also functions differently based on probably all this,
Oh yeah, because it causes so much inflammation. That's a root of a
right.
lot of mental health illnesses.
Yeah,
It's just like any other illness in the body. Most every other illness in the body is, a
yeah,
result of some type of inflammation caused from something on the
exactly.
outside that's not good.
When your brain gets clean from glucose, I think
Hmm.
your thinking is also different.
Oh
So
yeah.
that's what I feel. It's
Hmm.
very different.
There's one thing that comes to mind as we've been talking about this for this last hour and stuff, and that is hope. I think that there hasn't been a whole lot of hope. I think people have kind of given up. And I think that's something that we can at least, try and do our best to give back to people is that there is hope out there. You can reverse it. It's not easy, but nothing good ever comes easy. It takes a
Yeah,
lot of work and a lot of willpower, but you have, there's you know any one of us can certainly help someone in that in that realm in order to beat this and overcome it
yeah,
because it's not it's it I really it's sad to me when I hear, oh well, I'm diabetic, I've been diabetic, that doesn't help me, I can't do that, I can't do this, and like,
Yeah.
no, actually you can.
Hmm.
Or
yes,
if you
you
hear
can.
somebody passes from diabetes, it's just, God, it's gut wrenching because it's
It
preventable,
is. It
Yes,
absolutely
is.
preventable. But where's that hope? Where's
yeah,
that,
yeah,
but
Yeah.
there is hope out there, and
Yeah.
there's
yeah,
ways to do it.
Just need to spread the
yeah,
that word, that information.
Mhm.
right.
Hmm.
So it's past 7. It's a little more hour. So we just want to ask anyone who's listening or who will be watching this video later, if you have any topics that you would like us to discuss, please share on our social media and through the messenger any topics we can discuss. Next week we will be discussing it. Did we decide what are we discussing next week or?
Um, I had it written down.
Okay,
Oh, well, we didn't decide for sure what we were
okay.
talking about, so never mind.
Yeah, we have a lot of topics we want to talk to, so we gotta choose from one topic for next week. Just
There's
keep
just so
following
many
us,
good
right?
ones. There's so many. I mean, I
Right.
didn't even get to talk about Chat GPT and my whole research. That was like a whole
Right.
shamble. Oh, that would be a good
Yeah.
one too. So,
Okay. So we'll see you next week. Okay.
all right. Thanks, everybody.
Yeah.
Good night.
Thanks. Do you want to